As the world observes the International Day to End Obstetric Fistula, the devastating impact of the condition remains a stark reality for many women. Prolonged labor, illiteracy and poverty have been identified as the leading causes of obstetric fistula, a condition that continues to affect thousands across Nigeria. In this special report, ADBN Northwest correspondent Lawal Aliyu explores the struggles faced by fistula patients and the availability of treatments as calls for increased healthcare interventions grow stronger.
In Nigeria, an estimated 400,000 women suffer from obstetric fistula, with 50 to 100,000 new cases occurring annually. Unfortunately, only about 3,000 cases are repaired each year. According to Dr. Malami Muhammad Gada, a fistula surgeon in Mariam Abacha Women and Children Hospital in Sokoto, patients only visit hospital at a critical stage.
It's good to advocate for some policy changes and improve on our healthcare delivery system, because it's not what caused the fistula itself. It's not because some people has a belief that it's early marriage or no. If a woman gets pregnant and there is hospital, there is skillful birth attendant that can deliver that, it's okay. There's no way a woman can come down. And if there is no chance, she can't give birth, okay, there is doctor there, that hospital maybe can do cesarean section. So I see reason know why that woman will come down with the fistula.
Sometimes fistula patients face abandonment by their husbands and relatives, according to a patient who wished to conceal her identity and name herself Aisha Mamman.
I was diagnosed with fistula at birth, following a cesarean section. After that, I developed another fistula. I chose to focus on caring for my baby before seeking treatment. Once my baby turned 2 or 3 years old and became ill, I decided it was time to seek medical care. However, my husband's mother insisted it was better for her son to marry another wife rather than support me in my treatment. At the end, he divorced me.
Chief Medical Director of Mariam Abacha Women and Children Hospital, Dr. Hadiza Tori Abubakar, stated that the center is the only center in Sokoto attending to fistula patients.
So we are one of the VVF centers that take care of vesicovaginal fistula patients in the Northwest zone. So this hospital, being it a center for treatment of VVF patients, we have a comprehensive approach to doing that, because this hospital is not only meant for VVF patients, we also take care of women and children. Hence the name Mariam Abacha Women and Children Hospital Sokoto. So we have a comprehensive care for all women from the prenatal period, and that's antenatal period, labor, postnatal, and then also take care of patients that have the vaginal fistula.
A nurse attached to the fistula section of the hospital, Oliremi Ireti Abagbemi, noted that most patients suffer from psychological distress due to stigmatization.
No, we support them in many ways. Once they come like that, we give them psychological support. We let them know that this is not the end of the world. With this, they can still mingle with people. And know in community there is a stigma about this thing. Most of them, they are already depressed before coming to the hospital. We have to counsel them. As a woman, it can happen to anybody. Yes, it's not something that is hereditary. It can happen to anybody. It can happen to me. It can happen to anybody. So you take them as your own sister. You take them as your own blood, so that even if there is stigma in the community, once they come here, we used to rapport with them. They used to feel at home. Most of them, they used to sit with us, we gist with them, we do many things there so that they will not be distressed and they will forget their problem for the meantime. And because all of them, it's not all the VVF that is a surgery case, there's some that is a catheter case, that after they're using after the catheter treatment, they are free. So we used to tell her, don't listen, don't think that it's because of surgery you are afraid, you are afraid or anything. We used to give the psychological support, in short, before the surgery.
What are the challenges in managing and treating fistula?
Yes, we have some challenges that we are facing, even though some of the challenges we are trying to overcome them. Some of the challenges now we are facing, I would say, is, let me start with bed space, because now the number of patients that are presenting to us always is trying to overwhelm the little bed space we are having. Like in our VVF ward, we had like 46 bed space. Sometimes if we are doing full effort, we can even do more than 50. So we have to be mobilizing to see where we are going to keep them. So we need more bed space. And then another challenge we are having is the chronic patients, those that have stayed there for a very long time. Some are deemed untreatable. So we still have a lot of them living in our facility, of which we are trying to see how we can reduce their bulk, counsel them also to go back, to reintegrate them back into their society so that we can decongest their hostel.
With Nigeria accounting for 40% of global fistula cases, urgent intervention is required to improve healthcare and prevent new cases. Lawal Aliyu, ADBN News.